Welcome to This Week in Dermatology. This week, we're covering 10 notable papers spanning systemic manifestations and novel therapeutics in psoriasis, real-world outcomes in hair restoration, and emerging safety and diagnostic data in inflammatory dermatoses. Let's dive in. We begin with a deep look at psoriasis as a systemic disease and the potential for deep immunological resetting. In the Journal of the European Academy of Dermatology and Venereology, the PSOCADIA study provides critical insights into the subclinical cardiovascular burden carried by patients with psoriasis. This cross-sectional analysis compared 1,010 adults with psoriasis to 1,010 age and sex-matched controls without inflammatory skin disease. Despite having well-managed skin disease, patients with psoriasis exhibited a significantly higher burden of myocardial dysfunction. Specifically, myocardial dysfunction, defined by an abnormal global longitudinal strain of less than 16% on transthoracic echocardiography, was present in 16.7% of patients with psoriasis compared to just 6.0% of controls. This represents nearly triple the rate of myocardial dysfunction in the psoriasis group. Crucially, this association remained robust even after adjusting for traditional cardiometabolic risk factors and established atherosclerotic cardiovascular disease. Furthermore, the prevalence of cardiac dysfunction was remarkably consistent across different levels of psoriasis severity, meaning that even patients with mild or well-controlled skin disease are at elevated risk. Within the psoriasis cohort, higher body mass index and diabetes were independently associated with myocardial dysfunction. This highlights the vital clinical need for comprehensive cardiovascular assessment in all patients with psoriasis, regardless of how well their skin lesions are managed. Global longitudinal strain serves as a highly sensitive marker for early myocardial deformation, often detecting subclinical dysfunction long before changes in left ventricular ejection fraction become apparent. For practicing dermatologists, these findings underscore that managing psoriasis must extend beyond the skin, necessitating close coordination with primary care and cardiology to screen and manage cardiovascular risk factors aggressively, particularly in patients with concurrent metabolic comorbidities. While the PSOCADIA study emphasizes the chronic systemic burden of psoriasis, a remarkable case report in clinical and experimental dermatology points toward a potential therapeutic paradigm shift. Researchers documented the case of a 60-year-old woman with a 49-year history of severe treatment-refractory plaque psoriasis who underwent autologous CD19-directed chimeric antigen receptor, or CAR, T-cell therapy for follicular lymphoma. Remarkably, her psoriasis resolved completely within 4 weeks of receiving the CAR T-cell therapy. Even more striking is that she has remained in complete, treatment-free remission for over 4.5 years without any psoriasis-directed therapy. This durable, long-term remission suggests that deep tissue depletion of B lymphoid lineage cells might induce profound, permanent disease modification. Mechanistically, CD19 CAR T-cell therapy targets a much broader spectrum of B-cell populations than traditional anti-CD20 monoclonal antibodies like rituximab, which spare early progenitors and plasma cells. This deep depletion may disrupt the pathogenic B and T-cell interactions, antigen presentation, and autoreactive immune circuits that sustain chronic plaque psoriasis. This finding challenges the prevailing T-cell-centric paradigm of psoriasis and opens the door to exploring B-cell-directed immune reset strategies, such as CAR T-cell therapy, for achieving long-term drug-free remission or potentially even a cure in severe refractory disease. Moving next to hair loss and alopecia management, we examine new real-world data on both Janus kinase inhibition and oral minoxidil. In the Journal of the American Academy of Dermatology, researchers published a retrospective, single-center cohort study of 330 patients, evaluating the long-term real-world outcomes and tolerability of the Janus kinase inhibitor baricitinib. This study followed patients with alopecia areata, alopecia totalis, and alopecia universalis, utilizing objective trichoscopy monitoring to track treatment response and safety over an extended period. Trichoscopy provides a non-invasive, highly detailed method to assess hair shaft diameter, follicular yellow dots, and dystrophic hairs, offering a more precise measure of early regrowth and treatment adherence than visual inspection alone. This real-world cohort provides valuable longitudinal data on how patients with severe, extensive forms of alopecia respond to baricitinib outside the highly selected and controlled environment of clinical trials, helping clinicians set realistic expectations for long-term maintenance and monitoring. Concurrently, the search for optimized dosing strategies in androgenetic alopecia continues to evolve. A retrospective study published in the British Journal of Dermatology investigated the efficacy of daytime low-dose oral minoxidil dosing. The study authors evaluated whether altering the timing of low-dose oral minoxidil administration to daytime hours could enhance its clinical efficacy for patients with androgenetic alopecia. Low-dose oral minoxidil has become a cornerstone of hair restoration due to its ease of use and efficacy compared to topical formulations. However, optimizing its hemodynamic safety profile and therapeutic response remains a priority. This retrospective analysis adds to our understanding of how simple modifications in dosing schedules can potentially maximize the therapeutic benefit of established, low-cost oral therapies, perhaps by aligning drug levels with diurnal variations in follicular activity or systemic blood pressure. Next, we turn to important safety, prognostic, and management insights in mucosal, autoimmune blistering, and chronic inflammatory skin diseases. In the Journal of the American Academy of Dermatology, a 10-year, single-center, descriptive cohort analysis investigated the rate of malignant transformation in patients with mucosal lichen planus. Mucosal lichen planus, whether oral or genital, is a chronic, T-cell-mediated inflammatory condition that can cause persistent erosions and ulcerations. This long-term study provides essential baseline data for clinicians, helping to quantify the real-world risk of neoplastic progression to squamous cell carcinoma and inform clinical surveillance intervals for these often difficult-to-manage patients. In contrast, reassuring safety data regarding autoimmune blistering diseases comes from a study in clinical and experimental dermatology. This study utilized a nationally representative matched cohort to evaluate whether pemphigoid is associated with an increased risk of malignancies. Historically, there has been controversy regarding a potential association between bullous pemphigoid and internal malignancies, often confounded by the advanced age of these patients. The investigators found that pemphigoid was not associated with an increased risk of solid organ, hematologic, or non-melanoma skin malignancies. This finding provides significant clinical reassurance, suggesting that the underlying immune dysregulation in pemphigoid, or its standard maintenance immunosuppressive therapies, does not independently predispose patients to a higher cancer burden. For patients with pemphigus, managing the risk of relapse after therapy is a constant clinical challenge. A study in the Journal of the European Academy of Dermatology and Venereology developed a prognostic model designed to predict relapse in pemphigus patients who have been treated with rituximab. Rituximab has revolutionized the treatment of pemphigus by depleting pathogenic B cells, but relapse remains common as B cell populations reconstitute. This prognostic model aims to help clinicians risk stratify patients based on clinical and immunological markers, allowing for more personalized maintenance strategies and potentially preventing severe disease flares before they clinically manifest. Finally, in the realm of chronic inflammatory conditions, the therapeutic landscape for hidradenitis suppurativa continues to expand. A case series published in the Journal of the European Academy of Dermatology and Venereology examined the effect of the glucagon-like peptide-1 receptor agonist semaglutide on hidradenitis suppurativa disease control and patient quality of life. Given the strong association between hidradenitis suppurativa, obesity, insulin resistance, and metabolic syndrome, exploring the dual metabolic and anti-inflammatory benefits of GLP-1 receptor agonists represents an important area of active clinical interest, potentially offering a systemic therapy that addresses both the mechanical friction of obesity and the systemic inflammatory cascade. Our final theme explores novel therapeutic modalities and the integration of artificial intelligence in clinical practice. In the Journal of the American Academy of Dermatology, a prospective, randomized, controlled clinical trial evaluated the efficacy and safety of inhibitory magnetic stimulation for the treatment of refractory erythema of rosacea. Refractory facial erythema remains one of the most challenging aspects of rosacea to treat, often showing limited response to topical vasoconstrictors or oral anti-inflammatory agents. This study offers a potential non-pharmacologic, non-invasive option, evaluating how magnetic stimulation might modulate local microvascular tone and neurogenic inflammation to provide relief. While novel technologies offer exciting therapeutic avenues, the integration of artificial intelligence in diagnostics requires careful scrutiny. A study in clinical and experimental dermatology highlights a critical safety concern, reporting on a case of missed melanoma following skin lesion triage by an autonomous artificial intelligence system in a community setting. As autonomous AI triage systems are increasingly deployed in community and primary care settings to manage dermatology referral backlogs, this report serves as a stark reminder of their limitations. A missed melanoma can have catastrophic consequences for patient outcomes, underscoring that while AI can assist in workflow efficiency, it cannot replace the comprehensive physical examination and expert clinical judgment of a trained dermatologist. If you only have time for one paper this week, make it the cross-sectional analysis of the PSOCADIA study. This study demonstrates that nearly 17% of patients with psoriasis have subclinical myocardial dysfunction on echocardiography, nearly triple the rate of matched controls, independent of traditional cardiovascular risk factors and regardless of skin disease severity, making a compelling case for routine cardiovascular screening in all psoriasis patients. Here are the key takeaways from this week in dermatology. First, patients with psoriasis carry a high burden of subclinical myocardial dysfunction that does not correlate with skin disease severity, meaning all psoriasis patients should undergo cardiovascular risk assessment. Second, deep B-cell depletion via CD19 CAR T-cell therapy can induce long-term, drug-free remission in severe plaque psoriasis, challenging our traditional T-cell-focused understanding of the disease. Third, pemphigoid is not associated with an increased risk of solid organ, hematologic, or non-melanoma skin malignancies, offering valuable reassurance for long-term patient management. Fourth, while autonomous artificial intelligence tools are increasingly used for skin lesion triage, they can miss melanomas, highlighting that AI cannot replace formal clinical evaluation by a dermatologist. That's your roundup for This Week in Dermatology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.